I describe my early years of being a labor and delivery nurse as soul-crushing. There's no reason that African American women should have 4 times the highest death rate. For white women, about 12 women die per 100,000 live births, but 43 black women die. 12 versus 43. It's not genetic, it's not socio-economic, it stems from systemic racism embedded in the healthcare system that overlooks and undercares for these women. Often I hear from African American women that they aren't heard in the healthcare setting, that their complaints aren't taken seriously, that they have to be really repetitive and really aggressive in stating those complaints. And on the other hand, there's hypervigilance or hyper-surveillance. So black and brown families tend to have much greater scrutiny, their motives are often questioned. Black women are twice as likely to be drug tested. So where a Caucasian family might say, wait a minute, we don't want to do things that way, we want to know more about our alternatives. When black families do that same type of thing, they're often questioned and held suspect. The ongoing stress that African American women may be subject to in the healthcare system, it often serves as a disincentive for women to even enter the system. So they may enter prenatal care late, which again, if there are problems, they may go longer without being detected. It won't be done overnight. But what is really needed to fix this is culture change. The work has to begin with administrators who have the power to transform policy that folks have to conform to, that force them to examine their biases when they're in the midst of interactions.